Hi, welcome. I'm Carol Curdo, and I'm a program director at the Mass Association for the Blind and Visually Impaired. This afternoon's topic is aging and vision loss. Okay, we're going to start off with what are our goals today. Our goals are to learn about the healthy aging eye, because you know what, just because we get to be senior citizens doesn't mean we're going to get an eye disease and lose vision and maybe even become blind or visually impaired. Our second goal is to learn about some of those eye diseases. What part of the eye are they affecting, and what daily tasks are we having or possibly have trouble with that eye disease? Okay, and thirdly, well, let's learn some maybe kind of simple techniques that will benefit all of us, whether we've got some vision loss or not, and will help us to function a little bit better with our usable vision. Okay, the healthy but aging eye. There are kind of three major things that happen as we get a little bit older. And does something come to mind to you right away as we sort of maybe entered our 40s and our 50s? Mm-hmm. Okay, what was that?
Yeah. You said, yeah.
Well, what did you do to fix that?
Reading glasses.
Yeah, we got some reading glasses or maybe we've got some bifocals. Hi, welcome, come on in. And we've got we saved a seat just for you. How does that sound?
Okay.
Yeah, so maybe we got bifocals or even trifocals, that type of thing. It's easily correctable. And what really happened, okay? Well, what happens is part of our eye is called the lens. And that lens is usually very flexible. It directs light waves rays to the back of our eye and up to our brain, tells us what we're seeing. And you know what, as we get a little bit older, it's not so flexible, so it's harder to accommodate near tasks. That's why glasses will fix that. There's something else, I'm going to call it declining sensitivity. How's that sound? Okay, and what this means is we're going to have trouble maybe being able to distinguish maybe some colors, okay? Maybe that navy blue and black is looking very, very similar. Maybe that beige, pastel yellow, whitish color is looking very, very similar. Or totally different. Maybe outside, the curb and the street, maybe it's a little bit harder to judge that little depth perception because there's no distinction. There's no distinction in contrast with that, okay? And that's called declining sensitivity. Again, let's blame that lens on this because as we get older, the crystalline lens now yellows a little. So we just need better, sharper contrast to see things. And then there's one other kind of major thing, and that has to do with light. Actually, at our age, we need 4 times as much light as when we were in our 20s. And when we get to our 80s and 90s, we're going to need 10 times as much light. And you know, we're not going to blame this on the lens today, okay? We'll blame it on our pupil. Because guess what? This may not happen to the men, lucky, but it happens to us women. We kind of shrink just a little bit as we get a little bit older, maybe half an inch or so, maybe even more. And our pupil shrinks a little, so it can't let in quite as much light. Okay, that's why we need a little more light as we've gotten older. And talking with you before we started, one of you was asking about eyes are kind of itchy and watery. That could be, it doesn't mean, it isn't an age-related thing. But what happens is it is a condition you may have to deal with. It could be like a dry eye, it could be an allergy, that type of thing. But you know, there are medications that help alleviate that. It could be just you're a little more light sensitive now for a variety of reasons and it's causing some tearing, that type of thing. However, you would mention it to your doctor just to make sure it wasn't something else, okay? Can you think of anything else that's happened to you that has to do with your eyes and you're saying, ugh, what a pain that is?
Yeah, the sunlight.
Sunlight
is
just crazy, just crazy. And I'm going to talk a little bit more about that because there's some of the eye diseases actually makes your eye more susceptible to glare type thing. What I was kind of thinking of was floaters. Anybody have floaters?
Yeah.
Yeah.
Oh, yes.
Yeah, I mean, it's not an eye disease. And again, it's just something like the solution that keeps our eyes sort of round. Okay, what it is it's gotten kind of old and kind of sticky, and it may pull a little bit off of the retina, just little pieces. And those little floaters, they tend to settle in a day or two, or maybe even a month, that type of thing. Very, very common, not an eye disease, not interfering with your vision. Can anybody else think of any other
I have like a flash of light.
flash? Oh,
It's like a little lightning in your your eye. Or...
that's good to bring up. You know why? Because it could be a couple of things. What probably it is some kind of a little ocular migraine. Okay, and what she's explaining is, I believe, is you may see flashes, different flashes of light, okay? And it may last, 5, 10, 15, maybe even up to 30 minutes, okay? And it may even be followed by one of those migraine headaches, that type of thing. But again, it's nothing to worry about. However, the first time it happens, you want to make sure that your doctor knows, just to make sure that it's not something more serious than that, okay? Okay.
Yeah,
Okay,
I
good.
read that it's like a kaleidoscope sometimes,
Yeah,
all
yeah.
different colors,
Yeah.
excuse
Yeah,
Back
yeah.
out of you and you just pray God, please take it away.
Yeah, and then about how long before it kind of goes away?
Probably it's less than 3 minutes,
Yeah.
probably 3 or 4. It's some kind of migraine, without
Yeah.
the headache.
Without the headache,
So far,
yeah. Okay.
You want
Good.
this?
Well, okay. Oh, you're signing sheet. Oh, yeah, the senior centers always want a sign-in sheet. Thank you. Okay, so that's pretty much the healthy aging eye. Now we have to think about, well, what happens if we don't have a healthy aging eye? What if we get one of those eye diseases? Okay. Before we talk about a few of the eye diseases, we'll cover either 3 or 4, although there are a whole host of them. There are some terms you might want to know or have questions about. You may hear something like low vision, partially sighted, visually impaired, legally blind, blind. Those are all different terms to different organizations, although legally blind is a definition that entitles us to services from our state agency for the blind. That agency is called the Commission for the Blind. My organization is a private nonprofit organization, and we work with anybody who has vision issues. We don't have to wait until they've lost enough vision to be termed, quote, legally blind. Now, what does that mean, though? Legally blind, it's a definition. It's 20 over the number 200. Remember, if we have good vision, we've got 20 over 20 vision, 20/20 vision, okay. And what that means is if somebody has 20 over 200 vision, or worse, 20 over 300, 20 over 400, in the best eye, they've reached a definition and they can be declared legally blind and eligible for services. This doesn't mean they don't have any usable vision. In fact, they probably have a lot of usable vision, and they can learn new ways to do kind of some of our everyday tasks. Another reason that person could be declared legally blind is if they've lost a lot of their peripheral vision, so they have tunnel vision. In other words, if our visual field is 10 degrees or less, that type of thing. Okay. Eye diseases. What are we going to do about those? Oh, first I want to make sure you understand people with eye diseases have usable vision. And the goal is to maximize your functioning with usable vision. Okay? It doesn't mean everybody has the same amount of usable vision. It's all different, and the eye diseases make a difference too. So let's talk about some eye diseases. I'm going to start with macular degeneration because I know a couple of people here do have macular degeneration. Okay, so what's macular degeneration? Does anybody want to say a little something, a phrase, or start off with what macular might be? Or I can work with a lot of stuff.
I think it's fluid in back behind the retina.
Okay, problems with the retina?
Yeah, I thought it was like the retina breaking down itself.
Retina breaking down, okay. Anything else?
You can't see straight ahead.
Okay, we're getting closer now. Okay, macular degeneration affects the macula. The macula is a section on the back of our eye, the retina, Okay, and the macula is the source of our clear, sharp, colored reading vision. Okay. It's not affecting our peripheral vision. Our peripheral vision's not our clear, sharp reading vision, that's for sure. It's kind of our night vision, okay? So, if macular degeneration affects our clear, sharp, color reading vision, what kind of tasks, what kind of everyday things we do you think will be affected? Anybody?
Driving.
Driving,
Reading.
reading. Want to get even more specific? Those are really general. How about reading maybe headlines in the newspaper, reading a number in the telephone directory, reading your mail, reading a price, okay, reading your meds, your med bottles to see what you're supposed to take, and on and on and on. Okay, good, okay. There are two types of macular degeneration. There is the
Wet.
and the
Dry.
and the dry. Wet macular degeneration is more serious because it involves leaking blood vessels. Okay, we need to stop the blood. We need to cauterize those vessels. Yeah, previously, we used to do them with lasers, hot lasers, cold lasers. They also left a scar. Currently, the treatment is injections, eye injections, and the treatments actually are working well. Keep in mind, eye diseases are incurable, but the goal is to stop the degeneration or to stop the eye disease from getting worse, or at least to slow down the progress. That's probably the best thing to say, to slow down the progress. Okay, so what's that dry macular degeneration? Okay, dry macular doesn't involve any bleeding. Okay. In fact, you may hear your doctor talk about counting the number of drusen, little spots in your eye. But what does that mean? Well, for a lot of people, it doesn't mean a lot. Sometimes that dry macular degeneration is very, very slow degenerating, okay? And you may never reach legal blindness with that. Here's how you know, how will you know it might be getting worse, other than the doctor might say so? Well, if you looked at a door frame, okay, and it looked a little zigzaggy, or you looked at a flagpole, it looked a little zigzaggy, or you looked at the printed page and you couldn't see quite all of the letters, you saw parts of letters, that's when you know your dry macular degeneration is getting a little worse. In fact, if you have dry macular degeneration and it is a little bit more than just starting, your doctor will probably give you something like this to look at, an Amsler grid, okay? And this way, when you look at the Amsler grid each day and cover each eye, you just circle if you see crooked lines or you can't see a line and let the doctor know, that type of thing. Okay, so macular degeneration affects clear, sharp reading vision. It doesn't affect our peripheral vision, and it affects all those close-up activities. And the current treatment is medication for the eyes, injectable medication. Okay, now let's take a different eye disease, and we'll go to glaucoma. Does anybody want to start off the discussion with anything about what glaucoma might be or do?
Intraocular pressure.
Great, okay.
High intraocular pressure, something that's above normal for you.
Excellent. Most people say, oh, glaucoma, that's that pressure thing in the eye, okay? Not blood pressure, it's different, it's eye pressure. Many people actually can tolerate high blood pressure. However, glaucoma needs three things to have a diagnosis of actually glaucoma. Okay, it's the reason, what happens with glaucoma is, it's the sneak thief of sight. Okay, it's why every time we go to the eye doctor, we're tested for glaucoma. It's the leading cause of blindness in adults 35 and over. Remember the puff tests? Yeah, well, they don't do the puff tests anymore. They use a tonometer and we don't really feel it. But it's testing our pressure just to make sure. People diagnosed with glaucoma usually have, the standard treatment usually has to do with eye drops to keep the pressure low enough. Or surgery. There is a lot of different glaucomas. Open angle glaucoma may be helped with surgery. So, but what does glaucoma do? Well, it starts to attack our peripheral vision. Remember, macular degeneration was our straight ahead vision. Glaucoma attacks our peripheral, our up, our lower, our side vision. And at one point, we may have tunnel vision if not treated, that type of thing. People in third world countries or emerging countries without access to doctors may even go totally blind with glaucoma. Okay, if I had glaucoma and I lost significant vision and maybe I have some tunnel vision, what kind of important activity might be affected if you have tunnel vision?
Driving.
Yeah, driving. I was thinking of something even more basic. It's our mobility. Okay, sure, maybe we can look down and watch it, and then a branch hits us. Maybe we can watch it at this level, and then we trip over a curb, that type of thing. It's our mobility that can be affected. Okay. Let's take another eye disease. Let's do, I know what we're going to do, cataracts, okay, because, when we get older, everybody says, oh yeah, we must get these cataract things. It's an eye disease, that means we're not always guaranteed to get this. So, who's going to start off with giving me something to work with cataracts?
Vision.
What was that?
Vision.
Okay.
The lens clouding over.
Lens clouding over, okay, right, oh, that lens, oh my gosh, the lens again, okay. When we were born with the crystalline lens. Its job was to be very flexible and to direct all the light rays to the back of our retina and up to our brain to tell us what we're seeing. And then what happened as we got older? It got less flexible, okay, and then it got even kind of yellowish, and we need more contrast. Okay, well now you know what that lens is doing? It's starting to crack, okay? So the surface of the lens has multiple layers, okay? So as it's cracking, it can start in the corner of the eye. It usually starts in the corner of the eye. And again, it could quickly cover the eye. It may be slow going over the eye. It may just only stay in one part of the eye. But it's going to give you blurry type vision. When your vision becomes blurry, what kinds of activities will be affected? Reading.
Moving on. TV. Driving.
Everything. That's right, everything. Okay. So we've got to get rid of or do something with that crummy lens. It's no good anymore. Okay. So what we can do is we can vacuum out that lens. That's not crystalline. It's not even flexible anymore. It's not even yellow. It's already cracked. Okay, we can vacuum it out and insert a new folded up super duper plastic good to go lens and open it up over the little bit of base from that lens that's left. And there may be a bubble or so. Maybe you need a little laser treatment to fix it. And you're good to go. That type of thing. And people are very happy with the vision back, you know, with the non-blurry vision back. It's not there anymore. Okay. So it sounds like we've kind of cured that. No, we didn't cure it. We actually pulled out a lens and gave you another lens. Okay, so that's how that worked. Okay, do you know what cataract means? Waterfall. Okay, so if you're at Niagara Falls or some waterfall, you know, on your treks, and stood behind it, that's sort of what you could see, that kind of blurriness, if you had full-blown cataracts that really needed some surgery right away. Okay, so we've had macular degeneration affecting our clear, sharp color vision. We've had glaucoma affecting our peripheral vision, our mobility type stuff. We've had cataracts affecting our overall vision. And let's do diabetic retinopathy. When we have some of these systemic diseases like diabetes or MS for a long time, they can affect other organs in our body. So diabetes will affect the eyes or can affect the eyes. And it can cause the blood vessels to grow really crooked and to leak all over the eye. Okay, so if you had leaky leaky blood vessels over the eye and woke up and wanted to go and get your mail, you might not be able to read it. Okay, Maybe later on in the afternoon, some of that blood may have settled. Maybe you could see it a little bit better. Maybe it could affect you for days at a time, and other days you're good. It's really hard to plan things, plan your different activities when you don't know how your eyes are going to be functioning on that particular day. Okay. And again, the treatment is similar, laser or eye injections to stop that bleeding, that type of thing. And there's a whole host of other eye diseases, but I wanted to give you 4 sort of different ones. And now what I want to do is, just to give you a better idea of how someone might see if they had those eye diseases, why don't I kind of pass out something like this to peruse. And if you have enough usable vision to kind of see this at all? Yeah. Okay, at the top is a picture of a couple boys with their soccer balls, and it's our normal vision, or at least our 20/20 vision. Okay, and then underneath it is how someone with macular degeneration might be seeing the same picture. And you'll see that the central vision is kind of blurry. And then next to it is how somebody with diabetic retinopathy.
May I have one?
Oh, I'm sorry. Sure. Here. Yeah, okay.
She couldn't see me back here.
Right, yeah. Okay, and then at the bottom there's the cataract, it's kind of blurry. And then on the right lower side is glaucoma, so, you know, your peripheral vision is kind of blackened out. So it's different types of vision, and that means it's going to affect the way people can do different activities. So what happens when people have an eye disease and now they're significantly losing some vision and finding it more difficult to, you know, just be independent and productive? They'll need some training or some services, and it's always good to know where to go for that. So, for example, at my organization, the Mass Association for the Blind and Visually Impaired, we provide in-home training. We made it a medical service so that we could bill your insurance so you don't have to worry about things like that. And using an occupational therapist, will come into the home, see what it is you're having difficulty with, because you may be having difficulty with 5 things, and you may be having difficulty with 3 other completely different things. So it's partial, and that the OTs are very creative. They figure out different ways to do these things, and I'll kind of go over some ideas, that type of thing. People need to meet other people with vision loss. And see how they're doing and learn what they've learned, and be exposed to, like, well, how did it work with your spouse, or how did it work with your adult children? How's that relationship going? So there are support groups, and MAB has support groups throughout the state. Incidentally, our services are statewide. And many of us now want to continue with our toys. We want to make sure that if we lose vision, we still want to be able to use that smartphone and that iPad and the computer. Excuse me. So there's training, and we're expanding the training throughout the state. It's in Worcester and Fitchburg and Brookline and Chicopee and Harwich, and, you know, so there's more and more training centers being set up for all of us that want to continue or learn that, okay? One of the a really good program that is vital to people, especially when they've lost a lot of vision, could be a volunteer. And volunteers typically will go grocery shopping with people. They service their eyes. They might be reading the prices or the labels, while another person with an eye disease may be using his or her magnifier to do that on their own, that type of thing. And volunteers will go walking with you for exercise, and they'll come in and read journals and mail, that type of thing, if that's needed. It all depends on the amount of person's usable vision and what they need. There are even social workers trained to help people adjust to vision loss. And there are doctors, special doctors, low vision doctors, that actually look at your usable vision and see if magnification will help you, okay? So let's do the dots. Okay, the optometrist. Every day the optometrist wakes up and he or she says, I'm going to give my patient 20/20 vision with glasses or contact lenses or whatever. Then there's the ophthalmologist. We usually see the ophthalmologist when we get older. We want to make sure we're not having an eye disease. Every day the ophthalmologist wakes up and he or she says, I'm going to make sure my patient's eyes are healthy and I'm going to provide the best treatment I can to reduce the chance of eye diseases. And then there's a whole host of those specialists. There's the cataract specialist, there's the retinal specialist, there's the corneal specialist, and so on and so on. They're all medical doctors. Then there's a low vision doctor, usually almost always an optometrist again. Every day that low vision doctor wakes up and he or she says, I'm going to make sure that I can maximize that remaining vision of my patient to continue to be independent and productive as possible. And it'll be using optical devices or electronic magnification or contrast and that type of stuff. Okay, so now that we know there's a whole host of different doctors, now that we know OTs or other vision rehab specialists can come into the home and work with you on everyday tasks. And if you don't have enough usable vision, we've got some volunteers that can help with some of those kind of important, shopping errand type tasks. Let's look at some concepts that are going to help us with our vision, whether we have an eye disease or just a healthy aging eye. Okay, so how will we start off? Okay, let's start with light. Because didn't I say part of the healthy aging eye, we need more light because that pupil shrunk a little? Sure. And guess what? If you have eye diseases, you're definitely going to need more light. Now, the trick is, I'm not talking about increasing the wattage in the lamp on the end table that's 3 feet away from you. Okay, that's not going to be helpful. And the lighting up above that's actually causing you more glare than anything else is not going to help you. What will help is having a floor lamp or a desk lamp with an adjustable neck that can go over whatever it is you want to look at, whether you're looking at your nails, pictures of the kids, the grandkids, the mail, that type of thing. This is one of the single most important factors.
That's what I use every day.
Excellent.
Every day.
Incidentally, it doesn't have to be this ugly one. They have nice looking ones.
Yeah, I have to have it to read the paper and the
Okay.
mail, like you say, yeah.
Okay, good.
Perfectly. It was very helpful. Very helpful.
Okay. Number 2. I know what we're going to do. We've got to reduce glare. We've got to get rid of glare. How are we going to get rid of glare outside?
Sunglasses.
Yeah, we'll use sunglasses, a cap with a visor on it, something like that. What about the glare indoors?
Pull down the shades.
Pull down shades. Perhaps you've seen people with the sunglasses that are yellow, this type of thing. And that's just reducing glare. It's not reducing any of your vision at all. This will cut down on that indoor glare.
Yeah.
Yeah. I mean, you can try these, see if they make a difference. They don't make a difference for everybody, only for people that are experiencing glare. In keeping with that kind of yellow color, yellow acetate sheets can be put over magazines or other papers that are kind of shiny, and just putting that over reduces the glare, especially for people with macular degeneration. That's really a glary, or with cataracts, that's really glary issues. Okay. Then what can we do is we're going to want to increase contrast. Okay, if we increase contrast, maybe we can see things a little bit better.
Should you put these over glasses?
Yeah, they can go over your glasses. Yeah. You'll see a lot of people after cataract surgery, or maybe when they've had their eyes dilated, might have some yellow glasses on until their pupils shrink a little. Yeah, no, look up at the light, see if it makes a difference. Doesn't make a difference for everybody, okay, but it's just one of the tools that could be used. Okay, so how are we going to increase contrast? How about contrast, black and white, okay? I've left my glasses somewhere around the house, okay? And which scenario will I be able to find my glasses a little bit quicker?
The white one.
Yeah, because there's contrast.
Contrast, yeah.
This room is kind of interesting because it has contrast. Because look around the room, you'll see the dark wood against a white frame of the door frame. But then when you go further up the wall's kind of a light color, the frame's kind of a white color, there's not a contrast there, that type of thing. So contrast can really aid you in seeing things. For a person with reduced vision, for example, trying to find a clock in a big room, okay, great. The wall is light, the clock has a dark, it's actually black. Well, from where I'm standing, it could be blue or brown, but I think it's black, you know. A little bit easier to find that clock. Oh. You really should have just made sure you got it out there.
Yeah, I didn't want to.
Oh, yeah.
Thank you.
Okay. How about when we're cooking? How about when we're preparing? We're gonna cut up onions and green peppers. Okay. And let's see. It would be nice if maybe we didn't slice ourselves. So let's figure out a good way to do this safely. Okay. I've got 2 cutting boards. Here's my cutting board. Okay. Which one will I use to slice the onion?
Black.
Yes,
Black, yeah.
for the contrast. Yeah, we will see it a little better. And so which one will I use to do the green pepper?
The white.
Yeah. And it doesn't have to be black and white. I mean, you go to Target and you see yellow boards and dark green boards, and, you know, just some contrast type of thing.
It's a good idea.
Okay. How about when we're making, how about breakfast? Okay, we've got the white coffee cup, you know, just standard with, you know, white dishes. And we've got that cobalt blue coffee cup from the University of wherever our daughter or our granddaughter went to, right? Okay. Okay, coffee drinkers, which mug are you going to pour your coffee into in the hopes of not spilling?
The white one.
Perfect. Milk drinkers, which cup you going to use? Yeah, just for the contrast. I mean, there's, and you couldn't even go further with that as far as like reducing spilling. People that have lost some vision, they could use a tray. So if you're going to spill, you're only going to spill in the tray. Okay. You could use your thumb inside a cup or a glass until you feel the liquid reaching the top. They even make a gadget that buzzes. Okay. And even another idea. You can pour over a sink. So if you're going to spill into the sink. These are the different ways to approach doing things, doing common things, whereas you feel more comfortable, you feel more confident, you're not going to make a mess, or if a mess is made, you don't have to worry about it. Okay. What else could we do?
Steps?
What?
Steps, like stairs?
Stairs, okay. Maybe making them safer?
But I mean, even for contrast.
For contrast, sure.
To see.
We could tape a yellow tape over a dark stairs, just so you know where the edge of each step is. Yeah, there's a bunch of home modifications that can be done. Okay, I just pause. I'm not really thinking about what comes next. I mean, I know what I'm going to talk next. I just do it. So I'm just not standing here talking. Yeah. Okay. So what I was thinking of was, if we made something a little bigger, chances are maybe we could see it a little bit better. The bigger, maybe the retina could say like, oh, maybe I kind of see that. What's an example of making something bigger? What's the most common example of making something a little bit bigger?
Bigger face on your watch.
Magnification.
Yep. What was that one?
Magnification.
Okay, great. I'm so excited you're participating. Anything else?
Big TV.
Big TV, yeah. Okay, how about, large print is probably the first thing that pretty much comes to your mind. Yeah, make the print a little bit larger, give it some more white space, a little bit easier to see, sure. Excellent. People that actually have lost some vision, it's difficult for them to write and read their own handwriting. Okay, so perhaps they might want to use some lined paper like this. Actually, you can find this paper with some embossed lines on it too. makes it easier to read, especially if you're making a grocery list, and even better if you have someone coming in to do your shopping, that type of thing. Okay, but here's what I was thinking about. Oh, yes. Okay, who in this group uses large print checks? Why do people not know about this? Okay. Business size checks are like this size. Okay. Large print checks are, this is just a photocopy, they're yellow, and the black lines are just slightly raised so that somebody with declining vision can actually write in a straight line and read what they're writing. And whoever gets the check can also read what they're writing. Okay. Checks are available from the bank that you get your regular checks from. Theoretically, because you may have to remind them, they can't charge you more for large print checks than they charge for regular checks. A lot of times, this is just enough to do the trick for people. Just enough to make oh yeah, I feel a lot better. It's so much easier, especially if I'm using a lamp like this. Okay, but we live in New England, okay, and native New Englanders have told me, that's okay, I've got those regular checks, and I've got a whole bunch of them, and you know what? I'm not getting new ones. Okay. So there are templates or low vision things. Anyhow, OTs kind of can get you templates like this, designed to fit over a regular size check.
Oh.
All the checks you still have because you only write 3 checks a month. Okay. And this is great because the cutouts will show you, especially the person without much usable vision. This is for a person without much usable vision. You guys are all good. But anyhow, this is very helpful to them. They can write their own checks and feel like, okay, I filled it out and I filled them out in the correct spot. Okay. Then we can go to low vision things, low vision gadgets, talking clocks, talking watches, big face watches, items for our kitchen, for example, measuring cups that have big numbers on it, or measuring spoons that are in different contrasts for whatever it is we have to use it for. Makeup mirrors that are light, just a whole host of things that are helpful to people with some vision loss. And where do you get that stuff from? Well, from catalogs, okay? Catalogs such as Maxiates, that's a big one. We have whole catalogs full of things for independent living for people who are with vision loss and hearing loss also. So that's always nice to know. And then we have people that can be helped with tactile dots. For example, think about your stove, okay? And think about how you have to reach over and try to set the oven because you want to heat up something, or you want to use the microwave, whatever. So if you put tactile bump dots on it, that would be easier for a person that maybe didn't have lights under the counter, maybe they just couldn't see well. At least they'd be able to feel. For example, on the oven, we could put 2 bump dots on the dial setting, one at 325 and maybe one at 400. And this way you're pretty good with figuring out or estimating nicely whatever degrees you wanted your oven set at. Okay. And they come in all different colors and different textures like this because sometimes the color makes a difference. Incidentally, remember I said macular degeneration is the source of our clear, sharp color vision? People with advanced macular degeneration, with wet macular degeneration, may not be able to even tell the difference in the colors depending upon the intensity. For example, blacks, blues, deep reds, deep greens, maybe they can't even tell the color, so that's why tactile things are really good. You can put these on washing machines, dryers, remote controls, microwaves, the thermostat, things that, it's pretty helpful. And the colored electrical tape at the bottom, the best way to use this is for people who tend to bump into counters, or maybe they don't notice when their cabinet doors open. These colored fluorescent electrical tapes can be put on the siding, and a lot of times that's just enough to catch a person's eye where they won't bump into a cabinet top and realize it's open, or they won't hit that counter. Again, these things are different for people that haven't lost vision versus those that have lost some vision. Then we come to magnifiers. Okay, now do any of you use magnifiers at all? Yeah, okay. Are they magnifiers you got from the low vision exam doctor? In other words, are they lighted magnifiers?
No.
Okay. Here's the thing about magnifiers. One size does not fit all. If your magnifier is too strong, you will not be happy, you will be frustrated. Oh, this is great. Yeah. We remembered you're here. If your magnifier is too weak, you're going to be totally frustrated. So where and how are you going to know what strength magnifier you need? Well, that's why you have to go to find a low vision exam doctor, which we can tell you where there is one. Okay. If somebody has an eye disease and they need some magnification because they've lost some vision now, they need a magnifier with built-in lighting. That's the first thing we've got to look for. Both these magnifiers have lights. Good, okay. Wow, they look different. One's big, one's little, one's a different size, one's got sighting, okay. The most common magnifier you think of is what we call a handheld magnifier. What this means is you're going to hold it in your hand and you're going to figure out, like, I don't know, I got to hold it somewhere and try to figure out what it is it says. Okay. So this is a handheld magnifier, and guess what? This is really strong. You know why I know that? Because look at the surface area. It's pretty small. Okay. That's telling you it's strong. You know, a strong magnifier, you may be able to only read a word or a couple of letters, okay? But for the person that has just enough usable vision to see a word or a couple of letters, this can help them. It could help them with the mail. It could help them read a phone number, that type of thing, okay? So let's pretend this is a generic handheld magnifier. We place it on what it is we want to see. We bring it up. Well, first of all, we better put the light on. We bring it up, and it flips upside down. We say, oh, that's okay. Let's lower it until we can just see it the best. That means we have to hold that magnifier this amount of distance from whatever it is we're looking at. It's not much of a distance because it's strong. A weaker one, we could hold it higher. You need a little bit of practice, just a little bit of training to use it well, because one, you're going to have to be able to not lose your place. So the OT kind of trains you some ways to do stuff like that, okay? So this is kind of like a handheld one. Very good, you know what I mean? You can put it in your purse, you know, they're usually small enough. You can stick it in your purse, that type of thing, or your back pocket. This is called a stand magnifier because, one, you can place it right on what it is you want to see. This is helpful to people because as we age, many of us, not everybody, we have a weakness in our arm, or we may have like a senior tremor, that type of thing, and so we don't have to kind of hold it enough like this. We can just look at what we want to see and bring it across. Again, it'd be nice if we learned how to not lose our place, that type of thing. Okay, a little bit of training involved in that. This is not a very strong magnifier. You can tell by the size. Okay, so that's magnification. Then there's even something, and that's optical magnification. You know, our glasses are optical, it's glass, and these magnifiers are glass, okay. Then there's electronic magnification. That means like cameras. Cameras are taking a picture and they're making it bigger and they're flipping it onto a screen, but it may be something you're holding in your hand. So many of you, maybe even the senior center here, has a closed circuit TV. It looks something like these. Well, these are new ones, but it has a screen in front of it like a computer monitor It has a tray underneath that can be moved, and on the tray you put whatever it is you want to see onto the screen. In other words, the camera magnifies it and puts it on the screen. You can make it pretty big, and you can make it pretty small, but you can adjust it to what size you need. You can do a lot of things with a closed-circuit TV like that. You can put your mail on it, put your book on it, whatever you want to see. But, you know, what happens when we want to do our nails? You can cut your nails under it. You can look at pictures of the grandkids. You can look at your money and your coins so you know what you have, that type of thing. So anything that fits on the tray, you can then have it magnified up onto the screen. Also, just like magnifiers, they can come in a smaller version, okay? And it's quite helpful, although they will not magnify it quite as much as a closed-circuit TV. Okay, so we've covered a bunch of things that could be helpful to people with eye diseases. This could be helpful to us just because we're in this category called, I don't know, older adults, senior citizens, over 65, you know, that category, the getting older category. It's helpful for us too. At this point in time, I just want to make sure that you remember that we covered the healthy aging eye, things like needing reading glasses, things like needing more contrast to see curves, things like needing more light. We also talked a little bit about those different phrases and that they meant different things to different organizations, like visually impaired, legally blind, low vision, that type of stuff. We know there's a variety of doctors who have different goals in their life, that they're working with your vision. And we've covered 4 different eye diseases. There are a whole lot more, but we try to cover eye diseases that affect different parts of the eye so that you understand that different tasks can be affected. You also know at least 2 places to get help if you ever need our help in the future or want our help right now. If you do want your help right now and want us to call you, as soon as I'm done, let me take your name and phone number. Okay, those 2 organizations were our state agency for the blind, the Mass Commission for the Blind, and the organization I work for, the Association for the Blind and the Visually Impaired. And we also covered a number of interesting things that are helpful to us, whether we have an eye disease or not, as related to our vision. Okay, at this point, I can take some questions. If there's no immediate questions, we're going to end the presentation now, and I thank you for all your help in helping me do the presentation. I value all your input.
Well, thank you. Do you have any card or anything?
Yes, I will give you some. I will pass out some information for you. Okay. Thank you.